Dear friends, today we will be discussing about the Thomas test to measure the fixed flexion deformity, that is FFD of the hip joint in a unilateral hip pathology. FFD of a hip joint is a concealed sagittal plane deformity where the hip is flexed in some degree of flexion from where further flexion is possible but extension is not possible. In an ambulating patient, FFD is concealed due to compensation by downward tilt of the pelvis and exaggerated lumbar lordosis. Thomas test is performed to eliminate the compensation and to reveal the actual amount of FFD and to measure it with a goniometer. Sasikala ma'am will demonstrate the Thomas test. Patient lies in supine on hard couch. When the examiner passes his hand between the back of the patient and the couch, examiner will be able to pass his knuckles beyond the midline of the patient's body due to exaggerated lumbar lordosis. Now take out the hand and start flexing the opposite hip until the patient's back touches the couch, obliterating the lumbar lordosis. This is confirmed if the knuckles does not cross the midline of the patient's back when the examiner attempted to pass the hand between the couch and the patient's back. Now the exaggerated lumbar lordosis is obliterated and the hip comes into the flexion. Next, apply the gentle pressure on the right thigh, attempting to extend the right hip, and stop once the lumbar lordosis just begins to reappear. At this point, the actual amount of FFD of the right hip joint will be revealed. Ask the patient to hold his left knee to maintain that position. Place the goniometer on the side of the hip over the trochanter with one limb of the goniometer parallel to the couch and the other limb of the goniometer along the long axis of the thigh in its present position. The angle shown is the actual amount of FFD of the right hip joint. For instance, it is 30 degree in this case. Now, to measure the free flexion of the right hip joint, continue to flex the right hip joint and stop once the pelvis just begins to tilt upwards, which can be felt with the examiner's thumb over the right ASIS. Now place the goniometer again on the side of the hip over the trochanter with one limb of the goniometer parallel to the couch and the other limb of the goniometer along the long axis of the thigh in its current position. In this instance, it is 120 degrees. Therefore, free flexion of the right hip joint is from 30 degrees to 120 degrees. This is finally read as FFD of 30 degrees, free flexion of 30 to 120 degrees. Please note that if a patient with a FFD has not ambulated with a weight bearing of the affected limb, there will be no exaggerated lumbar lordosis, and in that scenario, FFD can be measured directly with a goniometer without the need to perform a Thomas test. If you like this video, please give us a thumbs up, subscribe to the channel and do kindly share with your friends for their benefit. See you again in our next video. Thank you.